Hello, everyone, and thank you for joining us this evening. Tonight is the second in our Integrative Therapies webinar series. Tonight, we'll be focusing on cognitive behavioral therapy for insomnia and acupressure. Before we get started, I'd like to just go over a couple of housekeeping items. You are in listen-only mode. This is just to minimize any audio distractions. But we do welcome your questions, and we'll have time at the end of the session for Q&A. So if you have something that you would like to ask, you can click the chat icon at the bottom of the screen to ask your question. Only myself and the presenters will be able to see your question. The session tonight is being recorded, and it will be posted to our website, excuse me, if you'd like to watch it back or for anyone who may have missed it. And lastly, we just ask that you don't share any personal medical information or questions in the chat box. If you have a medical question, please ask your doctor. And I'd like to thank our speakers for being here this evening. The quick introduction. Dr. Daniel Hall is a staff psychologist at Mass General Hospital, and he's an assistant professor of psychology at Harvard Medical School. His research is currently supported by the National Institutes of Health and the American Cancer Society. You can follow him on Twitter at Daniel Hall, PhD. Excuse me. Irene is a licensed acupuncturist and co-director of the Catherine A. Gallagher Integrative Therapies Program. Her clinical work focuses on optimizing symptom management and well-being for inpatients. Thank you so much to both of you for being here this evening. And now I turn it over to you.
Wonderful. Thank you, Devin, for the introduction. And it's a pleasure to be here with you all this evening. I'll be speaking about cognitive behavioral therapy for insomnia for cancer survivors. But as we all could probably relate to, the topic of sleep affects all comers. It doesn't discriminate. And we can acknowledge, especially given the recent climate and variety of stressors we've all faced related to the pandemic and et cetera, that there can be many factors that affect our sleep. And so tonight we'll be specifically talking about issues that can come up in cancer survivorship. Next slide, please. All right. Insomnia is a major health issue for survivors of cancer. And after primary treatment, surveillance often includes monitoring for physiological and psychological challenges. And among the most prevalent concerns facing patients after treatment is insomnia. And insomnia is defined as difficulty falling asleep, staying asleep, or waking. And this is an incredibly common issue, affecting between 30 and 50% of all survivors of various cancers. And this rate is twice as high as in the general population. For cancer survivors, there can be many reasons why sleep issues are especially common. Sleep habits can change after treatments, and there can also be late effects of treatments that affect your quality of sleep, as well as some medications for managing those late effects, things like pain, cognitive concerns, fear, anxiety, et cetera. And these medications can also impact sleep. Insomnia can become a chronic condition if sleep difficulties persist at least 3 nights per week for at least 3 months and cause significant distress and impairment. And so I like to draw this distinction because while many of us can relate to the experience of having a night or two of poor sleep, and this is incredibly common, when we're talking about the effects that sleep can have on your mental and physical health, we're talking about sleep difficulties that are really chronic and lasting, again, on 3 or more nights per week for at least 3 months. But we know that for cancer survivors, even these chronic levels are incredibly common and associated with greater challenges emotionally impairments in work and social functioning, being able to go to get-togethers or get back integrated into the workforce if that's a goal, and even overall quality of life can be impaired. There is some research also linking chronic insomnia to poor physical outcomes for adults affected by cancer, including poor immune functioning and increased fatigue. And so this is absolutely a concern that requires a lot of attention. Next slide, please. So the good news is there is evidence-based treatment available for managing insomnia. Irene is going to be sharing some research on this with a slightly different intervention approach that's very complementary actually to CBTI, and we can talk more about that later on in the webinar. But for right now, I wanted to share some of the evidence behind CBTI, or cognitive behavioral therapy for insomnia. Meta-analyses have found that CBTI is efficacious for cancer survivors in a variety of formats. It can be delivered virtually, it can be delivered face-to-face, it can be delivered in groups or individuals, and all of these approaches have been found compared with waitlist or other control groups to significantly improve insomnia. In fact, CBTI has been recommended as the first-line treatment for insomnia by both the American College of Physicians as well as the National Comprehensive Cancer Network, specifically for cancer survivors. And so we know that for cancer survivors who are struggling with sleep, we need to connect them with CBTI. I'll share in the next few slides some of the skills that are very commonly taught in CBTI, but you should also know that there are some challenges with accessing CBTI. Not everyone has access to a CBTI trained provider, and it can be really tough to attend weekly sessions, which is usually a part of CBTI. And so later on, we can discuss some of the challenges or considerations that you might need to think about before initiating this type of treatment. Okay, next slide, please. So the first skill that I'd like to share of CBTI is something that's called stimulus control. Now, oftentimes when our sleep is impaired, it can be a function of how we relate to the bed. And I mean that not just in an abstract way, but in terms of how we're conditioned to either stay awake in bed or to fall asleep in bed. So just like we operate on these principles of psychological conditioning with all facets of our lives, we learn over time with insomnia that the bed is a place not for sleep, but it's a place to eat. It's a place to read. It's a place for watching TV. It's a place to be on Twitter or Facebook. And the problem is over time, the mind picks up on that association and it is very confusing. The mind begins associating the bed not just with a place of rest or sexual activity, but with all of these other factors. And what we do with stimulus control therapy is work backwards to remove all of these activities from the bedroom as much as possible, focusing on the time in bed as a place where you're only sleeping or engaging in sexual activity. And so working with a therapist, you would be guided in making changes to things that you, doing activities that you might normally do in bed outside of the bed so that you have better what's called stimulus control. And stimulus being the bed as the stimulus for sleep. Okay, next slide, please. All right, so the second skill of CBTI is something called sleep restriction or sleep restriction therapy. And it sounds very scary, and I promise it is not scary, but it is, it does involve cutting back on your number of hours or minutes in bed. So what can happen over time with insomnia is that we have these periods of being awake and asleep, awake and asleep. And that's sort of represented here in the figure on the top line. where say yellow is time that you're awake and blue is time that you're asleep. And this sort of fragmented sleep is very confusing for the body. And one of the most efficient ways that we can go about improving our sleep is to first try to consolidate all of the time that you're actually sleeping into one solid chunk, if possible. So that's sort of represented in week 2 on the figure, where all of the time that you're spent sleeping is really consolidated. And once you're sleeping very efficiently, meaning the time that you're asleep divided by the time that you're in bed is very high, usually about 90% or higher, then we start adding more and more time that you can be in bed, and while maintaining a very high level of efficient sleep. So typically this is something that's done with a therapist guided by sleep diaries that you'd be filling out each night. And they would take a look at those sleep diaries and help you determine what time should you go into bed, what time should you leave bed in order to promote this efficient type of sleeping. All right, next slide, please. All right, so the third skill is sleep hygiene. And sleep hygiene is probably the type of skill that most people are familiar with. This involves making some changes to your bedroom environment, regulating your temperature, and this can come up a lot for adults affected by cancer, making certain changes to the amount of noise in your bedroom environment, the amount of, again, the temperature of the room, or what blankets you're wearing, what blankets your partner might need that you may not need, and negotiating that. These types of behaviors can be helpful for instilling a sense of confidence, but interestingly, research shows that as a standalone intervention, just teaching sleep hygiene is not evidence-based. And so it is a package deal as part of CBTI, but you should be aware that of all of the 5 skills of CBTI, sleep hygiene is the one that has the least amount of empirical support. But I do think it's helpful to teach because it teaches you a few things that are within your control. And that always helps when you're getting started on health behavior change. Next slide, please. Okay, skill number 4 is relaxation training. Relaxation is incredibly helpful for preparing the mind and body for sleep. And there's research that has shown that inducing even just 5 to 10 minutes of relaxation right before bed can help promote a more efficient transition into deeper levels of sleep that can be more restorative for your mind and body. Relaxation, though, can also be important, not just before bed, but also during the day, because as we're carrying stressors with us in our day-to-day experience, it can really accumulate at night. And if we're just doing relaxation at night, we may have a lot of stress that's built up by then. And so I usually like suggesting a little bit of relaxation before bed and a little bit of relaxation during the day to help buffer against the day-to-day stress and then help you prepare for sleep at night. One of the techniques that we teach in our program is an adapted body scan technique, where you bring attention to different parts of your body and just breathe in a relaxing way. And research has found this to be helpful, again, for reducing psychological and physiological tension before bed. Next slide, please. So the final skill covered in CBTI is what's called cognitive therapy techniques. And there are really 2 types of cognitive therapy skills that we teach in CBTI. The first is reframing. And oftentimes, when we are struggling with sleep, we develop these beliefs about sleep or about being awake that make us more stressed out. And the more stressed out we are, well, the harder it is to go to sleep. And so reframing some of these beliefs involves coming up with more balanced and helpful perspectives that might reduce the amount of fear or anxiety that you're putting on yourself right before bed. The other thing that can come up oftentimes in my work with cancer survivors is fear and worry related to cancer returning or progressing. And there are some helpful self-statements that you could consider for addressing those types of worries or fears. And you'll see some examples listed here on the slide. The second cognitive therapy skill is worry time. And worry time is something I'll come back to a little bit later on, so I won't spend too much covering it now. But it allows for you to set aside a certain time each day to honor the part of your mind that is active and maybe thinking about the worst case scenario, but doing it in a time and place of your choosing, which is not right before bed. Hopefully, you can develop some strategies for finding other times during your day to worry. So I think that just about wraps up my initial portion for the presentation. I think there may be one more slide. You good? Okay, I just wanted to mention here, there is active research taking place through the MGH Cancer Center, testing and evaluating cognitive behavioral therapy for cancer survivors that we're delivering virtually. This project is actually beginning to wrap up, but we do recognize our collaborators and look forward to continuing this line of work, hopefully with more funding very soon.
Thank you, Daniel. That was wonderful. So I'm going to essentially provide some techniques which might be helpful for part 4 of what Daniel was describing, the relaxation piece of this multifaceted approach to helping to address sleep. So acupressure is applying pressure with the hands and fingers to points in the body which would otherwise be needled. So I'm going to be talking about both acupuncture and acupressure, but the techniques I'm going to describe for you to use at home are acupressure techniques. Next slide. And again, please. So I just want to emphasize in the beginning that the kinds of therapies we're talking about are integrated therapies. So these are techniques you're going to be using in addition to what your physician or your psychologist is prescribing to help to manage sleep. So if you're potentially prescribed a course of cognitive behavioral therapy for insomnia or medication, you would add the acupressure techniques and the self-massage, the hand massage, to those techniques. So it's not something you're going to use instead of, it's something you're going to add to try to optimize symptom management. Because as Daniel mentioned, insomnia is really a multifaceted condition that can often need a multifaceted approach to help to address the symptoms. Next slide. And when we in the acupuncture world talk about insomnia, we always look at the physical and emotional pieces of insomnia as being intertwined. So a quick example, if I'm working with a breast cancer patient or a patient with prostate cancer, for example, who has a lot of hot flashes or sweating, that frequently the hot flashes or sweating are stimulated or worsened if they're anxious with anxiety. So especially if these symptoms are worse at night, going to sleep, there might be a lot of anticipatory worry about, oh, am I going to have a lot of sweating tonight? Am I going to be able to sleep through the night? As you're saying, what temperature should I have the room? All of the anxiety is going to make the physical symptoms worse. And we see that frequently where a lot of overthinking can result in difficulty sleeping. One point I did want to make, Daniel mentioned briefly that medication-related side effects can often be a factor. And when we work with patients who are in active treatment, there may be, we definitely encourage you to talk to your oncologist or your nurse practitioner, because you may be prescribed some medication for symptom management or side effect management that is then resulting in frequent waking, like medication which may cause you to urinate more frequently. And some medications can cause more vivid dreaming than normal. So if you've had a medication change and you're seeing a shift in your sleep quality, definitely talk to your doctor about that. Next slide. And next one. So I'm just going to talk briefly about two pieces of research. A lot of people ask how acupuncture and acupressure works. And this is a very old study from 2004, which found that the amount of melatonin found in urine increased significantly after patients got a course of 2 acupuncture sessions a week. And melatonin is a hormone the body naturally produces, which can help regulate the sleep cycle. And some people will take it as a supplement in conjunction with their talking with their doctor about it. So this research showed that acupuncture itself actually increased the amount of melatonin that was secreted during the night and had a result of a reduction in insomnia severity and a reduction in anxiety. Next slide. And this is just to illustrate the importance of looking at a multiplicity of options. This was a really good study that looked at acupuncture versus cognitive behavioral therapy for insomnia, and found that CBTI was better than acupuncture in this study, but both were helpful. So in both cases, there was a reduction in the severity of insomnia and then an enduring effect over time. So Daniel mentioned that there might be questions about availability of certain treatments. We, of course, are advocating for getting more of these services because insomnia is such a severe complication of treatment for our patients, but that sometimes you might need to incorporate more than one modality to try to address your symptoms. And there's good data showing that a multiplicity of modalities can be helpful. Next slide. So my acupuncture channels diagram, and I'm just showing this diagram to illustrate that you can apply pressure to one point on the hand, say a point here or here. There's a point for pain management. And as the acupuncture channels diagram shows, the acupuncture channels run along the arms, the legs, and the torso, just as the nerves, the peripheral and central nervous system, the blood vessels, the circulatory system, the connective tissue run from one part of the body to the next, and they're all intertwined. So that it may seem odd that applying pressure to one acupressure point could have a systemic effect, but that's what the research has shown. And I'm going to show you one acupressure point that has quite a bit of research supporting that, which is a nice thing to add to some of the strategies that Daniel mentioned previously. Next slide. So acupressure. Acupressure has a range of benefits. And I mentioned the issue around peripheral neuropathy because many people will find that some of their physical symptoms that are a consequence of treatment are worse at night. So many patients will report that neuropathy is worse at night. And we do have evidence showing that acupressure and acupuncture can help improve nerve conductivity in those sensory and motor nerves. Also, acupressure can help to increase relaxation and lead to a greater sense of well-being. And again, one of the things that I think is most helpful is this is something you can do for yourself. Just like the strategies that Daniel mentioned, if you have tools that you can use on your own at your home to help improve your symptoms, it's really empowering. And it's and the beneficial effects are cumulative. So if you can build this into the habits of your day, it's just a really nice option to have something you can do at home. Next slide, please. So before you do your acupressure, make sure you wash your hands. And we're all done, gotten very good at washing our hands this year. So I recommend you use a lotion that's gentle and that you know is going to be soothing to your skin. So be particularly careful if you have any kind of skin reaction to your medication. Just use something that you know is going to be kind to your skin. And for relaxation, we recommend using nice, slow, and gentle pressure. So we're not going to be doing anything too stimulating to the hands. The point is to really be kind to your hands, which work very hard all day and serve you well, and to really focus on nice and gentle and slow movements. And as I mentioned, the beneficial effects are cumulative. So if you can include this as part of your sleep time routine by having I have my giant size Vivino from Costco sitting here at the bedside. Whatever you need for your sleep time massage or relaxation, you have it at the bedside. And next slide, please. So I have this diagram up because I really want you to focus on the whole hand. And that is from, usually if you put lotion on, you just kind of go like this. But the focus on the individual digits, going all the way to the tip of the finger and giving it a squeeze. That's something that we don't do as frequently. So try to focus on going all the way to the tip of the finger when you're doing the massage and then giving it a quick squeeze. Next slide. And I include this slide just because it shows how many structures and how complicated the structures are in the hands and fingers. The tendons, the arteries, the veins, the fascia, the connective tissue, the nerve fibers, the blood vessels, all those very, very, very tiny sensory motor nerves at the tips of the hands. Hand massage is so relaxing because there's so many structures at the extremities. And some of the stronger acupressure and acupuncture points are at the extremities. And then skip ahead to Devin. Yes, perfect. So this is the point, the acupressure point that I want to show you. And I'm going to hold my hand up, and then I'm going to go off screen sharing after I demonstrate this, Devin, so I can show the hand massage with the full screen. So you're going to go to the pinky side of your hand and then go all the way down to the wrist crease. Now the wrist crease is the hinge here. And at the pinky side of the hand where it meets the wrist crease, you're going to run into a bone. And the bone is called the pisiform. And you can see on the diagram, it's this big knobby bone right at the edge of your wrist. And if you have any trouble feeling it, you can just flex your hand slightly and that'll loosen the skin a bit. And you're going to want to go over the bone to the inside part where you'll feel a big divot. And that's where you're going to want to land with your acupressure. You can use your finger. I also frequently will use the eraser end of a pencil, which just kind of slides right in there. And you're going to want to apply pressure to this point for anywhere from 30 seconds to 45 seconds, not long. You may feel a little bit of tingling, which will feel normal. But the research showed that using this point every night consistently resulted in a reduction in severity of insomnia symptoms. So now I'm going to just show you some of the massage techniques. Devin, if we could unshare. And I'm going to take some of my lotion and just make sure that my skin is very dry. And if you've been in this position all day at the computer keyboard, this is going to feel marvelous. So you're going to take the thumb of the opposite hand and just massage the palm and go all the way from the base of the wrist crease all the way up to where the fingers meet. And do this for maybe 10 seconds. You don't have to do it for long. And then you're going to take the thumb and the index finger of the opposite hand and just glide along your hand to the tip and give it a squeeze. And I like to do this 2 or 3 times. If you use a scented lotion for sleep time, something like lavender can be really helpful. I'm just going to do that 3 times, all the way to the tip, and give it a squeeze. Particularly if you're having a little bit of peripheral nervous system numbness, this can feel really good. And then go to the opposite hand, same thing, thumb, and then just massage the palm of the hand. And then thumb and opposite index finger all the way to the tip and give it a squeeze. And then I like to end with the acupressure. So I'm just going to, again, slide down the pinky side, run into that bone, the pisiform, glide over the bone to the divot, and then apply pressure. And then just finish with a nice little massage. And you're done. And then you can go over to Daniel and have your worry time. There you go.
Irene, there's no way I can follow that. Oh my goodness. This is remarkable. Thank you so much for leading us through that. I was following along with you, and I'm looking forward to trying this out later on this evening. So I just wanted to circle back to one of, I think it was the last skill that I had mentioned and that Irene just alluded to, this worry time practice. In my experience doing teaching cancer survivors CBTI, there can be a couple of benefits with worry time, and not just in terms of improving sleep, but also just for validating that there can be a lot of anxiety and sources of uncertainty that you're facing and that you're navigating as a cancer survivor and as somebody who's navigating all these complexities of life and life after cancer. And just setting aside a little bit of time each day to process these worries and process these thoughts so that they can have a minimal impact on your day-to-day life, it can be so liberating. And so I just want to frame worry time, not just in terms of sleep, but as a practice you might think of for honoring the part of you that's just, wondering about your future health, and if that type of uncertainty is a real source of worry or stress for you. So there are a couple of guidelines about worry time. Worry time is typically prescribed at about 10 minutes per day. And so usually what I would do is suggest, what's a 10-minute window where you can really afford to kind of get lost in your thoughts. This typically is not, like I said, right before bed is not a great time for worry time. Right before seeing friends and family or anything like that is probably not the best time for worry time. But if you have a commute, that can be a nice time to do worry time. If you have a ritual involving walking, whether it's indoors or outdoors, that might be a time for worry time. Some of my patients do worry time in the morning when they're taking their shower. You can experiment with it and see what works for you. But one of the hard challenges of worry time is really disconnecting from your worries after 10 minutes is up. And so that'll become an important skill that you learn to refine over time. Sometimes distraction is really helpful. So I always suggest beginning by setting a timer, set a timer either on your phone or watch for 10 minutes. And then when you're done, have a distraction ready. Maybe it's a photo that brings you back to a sense of purpose or value. Maybe it's a deep, relaxing breath. Maybe it's some hand acupressure. It could be any number of things that really ground you in the present moment and take you away from worrying about hypothetical what ifs that occupy our mind. The other thing is I recommend keeping a little journal by your bed just for bookmarking worries if they come up at night. And what I mean by that is if you're noticing yourself worrying in the evening and it's affecting your sleep, go ahead and turn to your little journal and write down 1 or 2 or 3 words that will remind you of what you want to worry about, and circle back to that tomorrow during your worry time. And so it will give your mind a sense of peace, knowing that you don't have to think it through in its entirety right then and there in that moment, that the evening is your time for sleep, and that you'll honor the part of your mind that's thinking about whatever it is you're worrying about tomorrow during your prescribed worry time. And so there are different ways we can personalize this. And as always, I do recommend, connecting with a therapist or someone who's trained in teaching a scheduled worry time practice. But you might find that it not only helps improve your sleep, but also is an effective tool for managing anxiety or worry during the day. And so I think with that, maybe we can wrap up and maybe shift to answering some of the questions that are starting to come in.
Absolutely. We've had a couple come in. Thank you both so much for that informative presentation. Getting to some here. I listen to music through my iPod to help me relax and fall asleep. Is that a good idea?
Daniel, you want to take that one?
I would say it's a good idea if you're sleeping well. If it's working well for you, then I would say that's okay. Having strategies that you use to get ready for bed and get good sleep, as long as they're effective, I would say that's fine. If you feel like you're still struggling with sleep, then I might suggest that's actually probably not as effective a tool as you might think it is. And you might try something else, maybe listening to music with a timer on, and so that the music automatically shuts off after maybe 5 minutes. And instead of listening with earphones, you listen on your speaker. But I don't know if the person who asked the question would have time to follow up, but I would say as long as you're sleeping well, then there's nothing wrong with going to sleep with music on.
Yeah.
Thank you. How do you not think about something worrisome at bedtime? Is there a best way to sort of turn off those thoughts until the worry time the next day?
This is a great question.
Yeah.
It is, worrying at night is very normal. It's usually a time when our mind is catching up with our bodies. And so I just want to begin by saying, I want to normalize this. And I would say, even if you haven't been affected by cancer, the nighttime can be a time for worrying. And that's, very common. One of the ways that worry time works is also through a process of conditioning, similar to that idea of stimulus control, where you condition yourself to fall asleep in bed. When we condition our minds to focus on our worries at a certain time each day, it becomes easier to disconnect from our worrying outside of that time. And so if you start developing a routine around, maybe worry time is with your morning shower, I might anticipate that it's easier for you to disconnect from worrying at night.
And I just had one thought around regrounding in the body, that rumination tends to be from the neck up. And that one of the techniques that we sometimes will teach patients, particularly if they're in the hospital, where it's difficult to get to sleep at night, is to try to reground in the body by putting one hand on the heart and one on the abdomen and focusing on the breath. And that when the thoughts interfere, to try to just gently return to the breath and the sensation of being in the body. And I think that is one of the challenges, is that insomnia is so complicated. So that might be one piece. Structuring some worry time might be another piece. That usually it will take more than one technique to try to interrupt that process of to interrupt insomnia, just the pattern that results in difficult sleep.
A couple of questions within this question. Is there such a thing as being a short sleeper and not requiring a full, say, 6 to 8 hours of sleep? I don't have issues falling asleep, but instead wake frequently during the night and often read to fall back asleep. Been doing this since before my diagnosis, and I don't feel tired during the day. During the day, excuse me, and when I wake up in the morning, I'm wide awake and not groggy. Do you have any thoughts on this?
I would, you, I would, to answer the first question, yes, there's such a thing as short sleepers. I'm not an expert on this, but I do work with, I have a few colleagues in behavioral sleep medicine who very recently we were talking about how to use CBTI with somebody who it looked like they were getting about 4 hours of sleep and they were really okay. You know, typically with CBTI, we don't, 4.5 hours or so is about the shortest that we would ever prescribe someone to be in bed. Usually we would want them to be in bed for longer than 4.5 hours. However, there are these rare exceptions, and it looks like there's some literature on these short sleepers. So you might be one of them, and you may not need that 4.5+ hours in bed. You know, it did sound like your sleep was interrupted, and you know, it might be that you don't need more total sleep duration, but that your sleep quality would improve with more consolidated sleep. So however much time you're actually sleeping, if you chunked it together into one period of time, you may give your mind enough time to cycle through the stages of sleep more continuously than if your sleep was interrupted a lot at night.
Daniel, if someone is waking up and say reading, do you recommend they stay in bed or get out of bed?
You should definitely get out of bed. Great question. We actually, part of stimulus control is something that we call the 15-30 rule, which actually I don't like using that language, especially when I'm working with cancer survivors. I don't like rules per se as much as like guidelines and working within what your body is telling you that you need. But the 15-30 rule says that if you're awake in bed for longer than 15 minutes, then you have to get up out of bed for 30 minutes. And the thinking is it takes about 30 minutes for you to develop enough of a sleep drive to really be exhausted enough to fall back asleep continuously. So short answer is yes. If you're going to read, please read outside of bed and come back into bed whenever you're ready to fall back to sleep.
Thank you. We're just about at the end here, but we do have a question about leg cramps. Are there any acupressure points to help address leg cramps at night when you're trying to sleep?
So first, I would definitely talk to your doctor about what might be causing the cramping, and that could be medication-related side effect. It could be, or even talking to one of the dietitians at Mass General. They sometimes there are nutritional deficiencies that can contribute to leg cramps. But if that's all ruled out, there are some points, some techniques, massaging. I'm assuming you're talking about calf cramping, so around the gastrocnemius. There are some massage techniques and some points on the back of the calves that that can be massaged to help to release if that muscle is spasming. And what we can do, I can definitely follow up offline if you want to leave Devin your contact information. I'd be glad to touch base and show you some points that you could try. Again, it's assuming that any medical reason for the cramping has been ruled out.
Thank you very much. And it appears that that's all the time that we have for this evening. So thank you everyone for joining us. I hope that this was helpful for you. And thank you, Daniel and Irene, for your expertise. Just to remind everybody, there are a couple more sessions as part of this series coming up in the next couple of weeks. If you can join, this is the link to register. And if not, the sessions will be recorded and posted to the website. In fact, our previous one on self-care strategies for nausea is up, as well as the series that we had last fall can be viewed as well. And just once again, thank you very much. I don't know if either of you have any final words for this evening.
This was great. And thank you so much for joining us. And I hope you can join us in some of the future sessions.
Thank you, everyone. Have a great night. Goodbye.
Thank you. Thank you, everyone.